Welcome back to TV5 News at 9. Too many babies in our region aren't making it to their first birthday. And in some of these heartbreaking cases, unsafe sleep practices have been a contributing factor. That's why we have representatives across the Great Lakes Bay region coming together to launch a collaborative campaign aimed at saving lives. Thank you all for being here this morning.
Thank you for having us.
Of course. So, Dr. Delisha Pruitt, we will start with you. You represent both the Saginaw County Health Department and CMU Health. Why was it important for your organization to really champion the Safe and Separate Sleep campaign? And tell us what that's all about.
Yes, over the last 40 years, the number of babies dying were increasing over time, and we needed to do something. So our Be Well partners came together to tackle this issue, and it's such a wonderful thing because normally we're separate, but together we've come together to tackle this issue. The campaign is to give evidence-based information to the whole village, moms, dad, anyone taking care of the baby, so that they know the ABCs of safe sleep and to decrease the rates of babies dying in the Saginaw County area and honestly across the state. We've seen where black babies have died more, and so we want to do something all together to decrease the risk of death and to keep these young babies that we love so much here in our community.
So important, so devastating to talk about. Angela, Covenant Healthcare and now Great Lakes Bay Health Center are involved as well. Your organization plays different roles from birthing hospital to pediatric follow-up visits. Why was it important for you to also come together for this campaign?
So we've been a long-standing partner of Covenant, CMU, the health department, and other entities in the community. And as Dr. Pruitt alluded to, infant mortality is a huge disparity, especially in the black and brown community of Saginaw County. And so the efforts and endeavors that we have embarked on, especially over the past 2 years with the implementation of a doula program. First formal doula program that's targeting marginalized populations in our community, which is serving as a liaison to help educate those families. And in addition to that, we have the maternal health, infant health program, and working in collaboration with CMU with the centering pregnancy as well. And another asset is our our doulas have become CHWs, so community health workers, meaning that they can still follow up with those high-risk parents, postpartum as well as long-standing if necessary. And so this is just a wonderful opportunity to showcase the partnership because each one of our entities complements the other in terms of the services that we render to the community.
Most definitely. We have Nicole Berkman here as well. Nicole, anything you want to add on to that or let our parents know when it comes to infant mortality rates?
So just to add on to that, it's also really nice with us coming together because we can have that consistent message through the continuum of care. So in our hospital, you mentioned the birthing hospital, that aspect, we are touching on the same points and the same education there, which is nice when they continue into the pediatric offices and even in the home with the doula program. So
definitely. Dr. Pruitt, the advice around infant sleep has kind of changed over time as well. Babies used to be placed on their stomachs. What have we learned about why it's safer for babies to sleep on their backs now?
We know that if the baby is on their stomach, then the baby has difficulty breathing, and so it's not, they don't get a lot of oxygen in. Also, if the baby spits up, the way the baby lays on the stomach causes it actually to go down into the lungs as the baby's on the stomach. So we all know when we know better, we do better. So now that we know better, we want every mom to, and dad, anybody taking care of the baby. We know sometimes it's easy to fall asleep with the baby, on your chest or, to put the baby somewhere on the couch or something like that. But we want them to always remember the ABCs. Make sure the baby's alone, or on their back, or in the crib, or pack and play. That's the most important thing. We know that this happens, but one time could be that tragic time. So each time we want to just keep thinking about that because we want to reduce the rates of infant mortality. And if there's something we can do to prevent it, let's do that. That's the ABCs.
And going off that, what would you say to parents who argue it's okay to sleep with their babies?
I know that sometimes when you have a baby, you really, really are tired. I liken it as like almost drunk sleep, where you just kind of like, you want to, it's just easiest to do it that way.
Just want to crash.
But
Yeah.
it could lead to a tragedy just that one time. And when we go over the cases in Saginaw County, we recognize no parent wants to lose their baby. And so that one time could be the one tragic time, and we don't want to take that risk. So remember the ABCs, that's the key: alone, on their back, in a pack and play and crib, and then you'll know your baby's safe and can make it and be healthy in our Saginaw community.
Perfect. Well, I think we have covered most of it already, but any final messages you want parents to be aware of, or any final reminders you want to get out there?
Yeah, like I said, when we know better, we do better when we know better, and now we know. A lot of grandparents and other people will say, no, it's okay to put the baby on the stomach. They used to do that, but now we know we can do better and decrease our rates, because we want to be known for great things, not infant mortality. So we want parents to know, teach the kids around you, teach the kids babysitting. Educational efforts are going out to make sure everyone knows in the village that the baby needs to have the ABCs to stay safe.
Right. We're wiser now. We know
wiser
more,
now.
so we can do more
Exactly.
now. Nicole, Angela, is there anything else you wanted to add onto that?
Reflecting on the grandmothers and the aunties, and I remember those days when they say, take that baby and lay that baby on the stomach. And so changing that mentality and changing that practice. And I was in a meeting the other day, and we talked about teens who are taking care of babysitting, and so the importance of teaching our teens and other family members the safe way to allow a baby to rest.
This is so important for babysitters to take note of too. That's a good point.
Yeah.
All right. Well, ladies, I think that concludes, but thank you so much for being here and sharing more information. This is so important.
Thank you.
Of course. You can always find more information on today's topic as well by going to our website. Click on the hot link section of WNEM.com.